Hey everybody, it's Dr. Sam, and I received a question from a concerned mom. She's got a child who's just been diagnosed with fourth nerve palsy, and this means that the extraocular muscle that controls the torsion of the eye is paralyzed, and this is creating headaches for him, and she's concerned. So he did have an MRI, and everything checked out that way. So I think about this in a couple of ways. Stress, trauma, and toxicity would be the three areas that I would explore. The trauma could be something that could be old, like birth trauma, or just falling down. There can even be emotional trauma. Toxicity could be, some kind of exposure that has compromised the immune system or the neuromuscular health, and of course, visual stress. So at this point, there are a couple things that I would consider. Number one, if you could find a really skilled craniosacral therapist, somebody who works with kids, that could be really beneficial at seeing if you could release the muscle, if you could improve the function of the muscle as it relates to the entire eye. That would be my number one. Number two, I would consider finding a homeopath, somebody who does constitutional homeopathy. If there's a deep-seated psycho-emotional or traumatic reason why this has been triggered, if you can find a good homeopath, sometimes there's a remedy that can help release that. And then number three, I would suggest some type of physical vision therapy. This is a form of physical therapy where the child would relearn how to use their two eyes together, because part of the headaches could be either he's in double vision or the brain is suppressing one of the eyes to avoid double. We don't know because he's not been tested in that way. So those would be the things I would start with. I wish you the very best. Take care.